Welcome to Bite-Sized Dental Marketing. We are joined today with the great, the incredible Mr. Jake Pegg, our paid media specialist here at Pain-Free Dental Marketing. Jake, thank you so much for joining us today to talk about all things paid media.
Yeah, absolutely. It's good to be back.
Jake, you know I have a background in SEO, and we've always battled and butted heads on is SEO more important? Is paid media more important? In your journey so far at Pain Free, what is there a middle ground? Is one more important? Is the other less important? What can you share with us for dentists wanting to get some dental marketing going and can't decide between SEO or paid media and whether it's the best strategy?
I think I would mention two things. The first is that, SEO is always going to be more of a slow burn, right? You're doing your work in cycles and then you're checking to see the results monthly, right? You would have more insight into this, but I think, monthly and
It
just
takes time.
over the years.
Yeah.
It takes time. Whereas paid media is going to be like that shot of adrenaline, right? You're trying to kickstart something, you know what you're trying to find right now. And they both play an important role. So if I were a dentist, I would be running both. I would have SEO and I would have paid media. An example I always love to give to some of our clients is, if SEO is seeing that, we're not showing up for keywords surrounding veneers, well, then paid media can take that, right? And because we're putting money behind it, it's inorganic, but we can start showing up for veneers. We
a lot quicker.
We can cover that weakness, right? Another thing we often talk about is kind of ad real estate or search real estate, right? So if you search for dentist near me and the first three options are those ads, right? They're sponsored, and maybe you'll see the ad for your practice, and then you'll see some relevant site links for, maybe the About Us page or something related to what you've been searching for in the last, couple of hours. Well, that's great, but maybe you keep scrolling and then you see the organic listing, right? That almost gives it more credibility because you've now seen two listings for the same practice, right? And so that's when we talk about like search real estate or taking up the real estate on
they
the
can
search
work
platform.
together.
Yeah,
they can work together. And I mean, one question that we often get, people have gotten a lot smarter when it comes to paid media and ads and knowing what is an ad and what's not. Because I think back in the day, especially with an older generation, if I think to my grandmother and even my parents to some extent who are now late 50s, 60, turning 60 this year, funny enough, my dad would click, he would open it up and he would, okay, there's the thing that I wanted and I'm going to click there. Whether it said sponsored or not is irrelevant at this point. He's the perfect example. And as I said, my grandmother too, the perfect example of the person that you want. Top result, I'm going to click on it and I'm going to go to that page. But what we've seen, especially operating in the space that we do, of course, and having such a broad experiment, if you will, with practices all over soon over the world, but the United States, is it's gotten less effective over time. What would you say to a dentist that comes to you with that argument of, I've heard this is becoming less effective. Why should I still bid on that top keyword or for that keyword that people are going to scroll by anyway? You mentioned one now about seeing the name twice. So do you have anything else there that you would be able to share?
Yeah, to continue on the seeing the name twice thing, we have seen sometimes, because we track the calls, right? We've turned off search ads for a client because we were not seeing any performance or any calls that were directly attributed to search ads, right? So to us, that was like, okay, then why are we bidding on this, right? Why are we spending the money? But then we have noticed that actually organic traffic went down as well, right? I won't say every single case, right? There have been cases where it was fine, but there have been cases as well where inexplicably the organic traffic also went down. So that, when the only variable that changed was that the Google ads went down.
You got to think about it.
Yeah, you got to think about it. Google over this next year And some of the things that have already been happening are them cracking down on cookies, cracking down on some of the privacy settings and how we can track people. And so I think in some ways it might even get more nebulous, right? Depending on how things shake out. But you did ask me, why try it, right? I think for a certain dentist, if you have a big existing patient base, right? If you're already ranking number one on all the keywords that you care about, if you're doing great, then I would actually say you probably aren't the best candidate for Google search ads, right? And that's something we would be transparent about, but I don't think you are the best candidate
Let's
for
take that money and let's put the money somewhere else. Let's do something else with that cash.
Let's re-engage your existing patient base. Let's focus on giving an amazing experience to your existing patients, right? So that they then tell their friends, right? Let's focus on the organic side. However, if you're struggling, if you are a startup, right, and you need to get to that level, right, that's where you do need the paid ads, in my opinion, right? Or you have a new growth goal. You want to hit a new average number of new patients per month, right? You're going to need to do paid search, I think. Yeah.
And especially, I mean, you mentioned something important now that I would love for you to talk more about. Startups is one that we've often seen. It's very exciting as a dental marketing company to work with startups, but it's also that anxiety of like, we're going to throw everything we've got at this and test things. And I mean, everything from A/B testing on the websites to the ads to building the foundation of SEO, doing where are we going to strike gold first, and then let's build out on that, and then continue to build other resources around that to make that snowball grow bigger. Where have you seen success when it comes to paid media with startups, and what would you recommend to a startup dental practice if we're talking about paid media?
I think if you're a startup, right, you've just created your Google My Business listing. You've just set up kind of the core digital marketing functions, right? Correct me if I'm wrong, but you're on the SEO side, you're going to be like non-existent, right? In the backend Google directory, you're going to be nobody.
Let's make sure you're indexed first. Yeah, yes. Let's get you indexed first. That's how early we are in the phase.
Yet again, another example of why SEO is super important to paid media as well, right? Your ad rank, this is a backend Google assessing the quality of your ad, is also reliant on the landing page that you're trying to send them to. That's the website, and that takes into account also how Google has indexed and kind of put your website into the directory, right? So if you're super new, right, then your ad quality score is probably going to be pretty low. Today we were talking about with a client, right, emergency, right? We were running emergency ads for him, and that's actually been working out well because he is then able to convert them into new patients because he's a great dentist, he does great work, and then they love him, right? These are some of the wins that we can look for when we're doing ads for startups. I would still run ads on general new dentistry, dentist near me, but I think it will be difficult at the very beginning to compete with the more established players. Not to mention that the longer that your Google Ads campaigns exist and are collecting data, the more optimized they will be, right? So performance, if you're doing the right things, should always be going up with paid media, barring, algorithm changes and market shifts, things like that. But if you're optimizing the campaigns, a campaign I've been running for 5 years has the data and the optimizations for Google to be reaching better people than the account I set up for you last week. Right?
Of course, that makes perfect sense. And the one thing you touched on now is the ad quality score, and that's something I don't think most dentists completely understand, or even something I'm sure other marketers would find interesting hearing more about. The ad score, how do I get that up? Why would it go down? What do I need to make sure of? Please take me through it.
This one's such a complicated thing. In some ways, Google tells me what some of the things it looks at are, but I often assume, as with a lot of Google things, that there's a whole lot more going into it as well. I'm sure,
No,
I'm sure
they have
you've
their
got your fair
secrets.
share.
I think they're sharing like maybe half of what's actually going on. Yeah.
But the obvious one would be if I've created an ad for you for dental implants, then I'm running the ads for keywords that will be dental implant centered. So, oral surgeon near me, or dental implants clinic near me, whatever it is, right? We'll have lots of different ad groups with different keywords, but that's the gist. The quality score and the ad rank will be on Google's end, trying to determine if you're actually advertising what is on your landing page.
Okay.
So
That
it'll
makes
look
sense.
at the most
Because it's
basic
user,
level.
it's all about user. Why am I going to show an ad if that destination of that ad is not directly related to the ad that's being displayed? It makes sense.
And once again, we're getting into kind of like that SEO territory
of building out these pages and having the right content.
Having the right content, the right keywords on there. And this is where actually sometimes there's some friction between SEO and tech and paid media, right? Because if I'm paid media, I want that ad rank to be good, but I also want really catchy slogans, right? On the landing page, I want very clear call to actions. Certain design things I want. Website team might disagree with me, right? They're like, that's going to hurt the speed of the page. That's going, whatever it is, right?
We've had our fair share of battles,
SEO might say, well, that's going to hurt the ranking of your page, right? So there's kind of a
my
pull
biggest
between,
one was I want this H1 because that's heading 1. For those who don't know, that's the most important title on your page because Google uses that to determine what the page is about. And I would want to, of course, have something like we provide dental implants in Colleyville, Texas, and then the design team or the web team would say, no. I was thinking rather we do like a beautiful design here that says lasting smiles forever. And I'm like, or something catchy, as you said, but then you have that of, well, we changed it and then the rankings went down or the quality score of the ad changed. But I guess that is that dance that you need to have is where good marketing happens. That is where you need to figure out what can I take enough of, what can I give enough of to keep Jake happy at paid media or Ian happy at SEO and the next guy at tech. So that's a good point.
And
that's
let me give you another example here. I'm now voicing my frustration
on the air.
Google, right, with the ad relevance, with the quality score, the ad rank. This also goes with how we use headlines. So if our headlines are not, by Google's standpoint, advertising what we're advertising, right, or what's on the landing page, or what our keywords are, our score will go down. Example of this would be I'm running an ad on keywords like implants, dental implants, single tooth implants, whatever it is. I'm going to have a bunch of different keywords, probably around 7 to 10. Google is going to call my ad anywhere from poor ad relevance to excellent ad relevance, depending on if my headlines are matching my keywords. So what happens is my headlines will become very generic, right? It'll say, implants near you. It'll say, oral surgery, whatever it is, right? It'll be very generic. This is what we do. This is where we are. And that's really boring. And so here's the test that I did. I had one that was excellent. So the very boring ad copy that Google said, this is an excellent ad. Okay. And then I had an ad that was poor. Okay. And this was the Jake special. I had what I thought was good ad copy, right? Custom ad copy that I'd created. That I was like, this is really showcasing who they are. I did say, right, like implants near you, that's still near me. That's important still, but I'm also saying doing more of the creative work. I'm trying to create a compelling ad. And Google's saying that's poor. But what I saw was that on the excellent ad, I had a lower click-through rate. Less people clicked on my ad, probably because it was boring, but I had a ton of impressions. Google was showing my ad to a lot of people.
Okay.
You can see where this is going.
Yeah,
my
that's interesting.
my poor one, had a higher click-through rate. More people, the people who saw it liked it, right? And they would click through to the landing page. But because Google didn't like it, they wouldn't show it to as many people. So that was like a very interesting thing that I came across.
So are you telling me, Jake, that we should not take that quality score as seriously?
There's a balance.
Okay. Okay.
I'm not going to live and die by that excellent qualification, right?
Does that
But
impact cost per click or the quality score, or is it just the surrounding bidding that is impacting the cost of that ad at the end of the day?
it would impact cost per click, I think, because if Google is saying your ad is not relevant to what you're advertising, they probably are not going to show you to the person who they think is the most I guess intent driven customer, right? Patient.
Because that's one thing
There's
I've
a
heard.
lot of there's a
Yeah,
lot of different things that play with this, right?
because I agree
So
with
that's where
you. I
I kind of
mean,
have to do the mental gymnastics
yeah,
of what would go down like.
because you want to. I mean, a big focus. I know that at least that you and I have spoken about is we need to at least make it appealing. Like people, I remember in my early SEO days, I would focus on the keywords and I would focus on what Google Search Liaisons documents is telling me and how to match intent and do these type of things. But you do, as we do, as you just mentioned, you tend to test things and you try and see, okay, but if I do this instead and I don't follow that exactly, what's going to happen? And at times, yes, sometimes it would be a miss completely and you would see a tanking or a dropping because you changed the keyword. But then other times it would not affect the rankings at all. And your click-through rate would go up because you have more enticing copy. As you said, it's, of course, we all read the search titles, even if people don't think that they do it that intently or that there is a mind game happening as you're scrolling through Google. There's a reason your brain is looking at one rather than the other one, even if you are not purposefully going, which one do I like most in this search result right now?
Yeah.
And that's where Google, you guys, you missed it there. Come on. Like, I hope you guys are listening because I agree. It's like you shouldn't have to play if the argument is we want to make sure it's more user friendly, that content is written for the user, that the user is getting the best experience, then you should not be awarding generic copy or keywords matching the intent directly versus a good ad that you put time and thought
Right.
into, as you
I
said.
mean, granted, right, it's an algorithm.
That is true.
It's not Joe at Google going through my ad and calling it terrible.
Come on, Joe.
Come on.
Yeah, that's true. That's true.
But so yeah, I mean, it is sort of like SEO in that way. Like we have an idea of the rules, right? And we just gotta play with them or play by those rules and break them a little where we need to, so that we're not just robots.
That is true. That is true. Jake, I want to ask you a final question.
Okay.
If I didn't have a lot of cash now, because this is one that I think is also definitely a lot of dentists can relate to, and one that we've experienced ourselves. This is my budget. It's being burnt up quickly. Let's say $500 to $1,000. I'll give you a bit
And
more.
you're doing your own Google ads. Here's my advice. Okay. Do your research on Keyword Planner to get an idea of what the cost per clicks are for your area. That's definitely step one. It's important. If you're running ads on a limited budget, once you have an indication of how much some of these clicks are going to cost, right? Because, say you're running, you have $300 a month, right? If you're getting clicks that are worth $10, you're going to get 30 clicks for the month. You're going to get one click a day. Okay.
Yeah.
You either need the best website in the world right? Or you need something, right?
Just convert
Yeah.
convert every single click.
Like if
Yeah.
you're, yeah, I mean, it's going to be tough. But that's where, you can't afford to be bidding on $10 keywords. Maybe that means you need to say goodbye to dentist near me, as weird as that sounds, saying that out loud, right? Maybe you need to look for less intentful keywords. You've talked about this, longer tail keywords, long tail keywords that are maybe talking about the problem rather than the solution. Maybe it's saying my teeth are hurting, and
just to try
there
and gather
aren't
some.
right. There aren't as many people bidding on it, perhaps. So maybe you can get clicks for $2, $5, right? You can't cover all the bases. You can't do sleep apnea and Invisalign and implants and pick one, pick two, maybe depending on your budget, right? But you have to pick a focus.
Think of your ads as I always think of it as a cup of water. Let's say you have a bucket of water, and then you can fill up 50 cups, little cups. If I throw that onto a fire that's here in my house, that one little cup, yes, it'll help a little bit, but then the fire comes. It's not going to solve the problem or achieve what you want it to achieve. Let me rather say it that way.
Mm-hmm.
But a more narrow focus, as you're saying, if I have all of that water in one bucket, especially if it's not that much, and I can throw that onto the fire, it's going to achieve at least more of what I wanted to do for that specific thing over having bits, because, again, your budget will either run out so quickly and it will make no difference, and you're still spending that cash. I think that's what you remember that.
And importantly, with your example, you're not going to learn anything, right?
Mm.
We're always testing. We need data to see what's working and what's not. If I'm running on too many different things and I'm just getting a click here, a click there, that's
not going to help you.
You can't really learn anything from that. All my percentages are going to be so scaled down, right? Click-through rates, things like that it won't be impactful to the types of things you need to be looking at.
And Bing? Yeah. Have you touched on Bing?
Yep, that was going to be my next one.
Okay.
You can definitely try out Bing. We have had success with Bing. There are less advertisers. There is, granted, less of a search volume. And so one thing we've noticed is if you're running, say, $500 on Bing, it's the opposite of Google. There isn't enough search volume there for you to just pick one thing. This is something we learned painfully. You can do the spread, and you're going to see cost per clicks of like from 50 cents to $3 to $5. It's a lot more affordable. We have seen conversions from it. I think there tends to be an older population, older demographic running Bing. They got a new computer. They don't know how to change the default search engine. And so they're on the default, which is Bing. And I think we're going to see, we've talked about this before too, but we'll see, I think, a bit of a rise in Bing as well, with Microsoft and their ties to ChatGPT, right? They've already incorporated some sort of bot, some sort of AI into their search. And so actually, if you went to Bing right now and you were doing a search, I think it's if you scroll up, you would see a chatbot actually join, and it would give you suggestions. You can talk to it, all the fun
stuff you can do. Yeah,
AI things. But they're doing things to try and grow Bing. Not to mention, Google's had such a monopoly on search engines. So from the government as well, I mean, you see headlines about they're thinking about breaking up the monopoly on search engine, right? Now, of course, I don't know if that would ever happen or how it would happen, but I mean, these are things being thought about. So, yeah, I'm a believer in Bing.
So, Jake, to summarize, if you will, give us 3 things that we should remember, and that's important when it comes to Google ads or just paid media for dentists. What are 3 lessons you've learned that is important?
Test all the time, and always. I'm cheating a little. This is part of the same one, okay? Because there's so many. test all the time and always be checking your search terms. This is what people have actually typed in and then found your ad. You'll find some of the longer tailed keywords. You'll find some gold mines in there. So always test and always check those. Try out Bing. I really like Bing. It's awesome when we see a conversion that was like a $3.50 click.
Yeah,
like that is,
and it's like a $5,000 treatment.
Yes.
Yeah.
It's like all on 4.
How much did that cost
And-
me? $5. It's like,
yes, it's awesome. Yeah, try out Bing. And then, man, last one. That's tough. I think always keep in mind that balance between pleasing your Google overlords, right? Doing what you need to do for the algorithm while still being creative and, putting your voice right into the ads. I think that would be tip number 3. It's just, you can't go one way or the other all the way. But you just have to try and find that sweet spot.
Find the balance. That's perfectly said, Jake. Thank you so much for sharing your wisdom here today. I'm sure there's a whole list of nuggets here that people can go and take. And whether you're a marketer or a dentist, it's important to know these things because it's how success is determined. It's how success is made. And we hope that you can take something from this and bring more success to your practice. Jake, thank you so much. It was lovely to have you. Until next time.